Hi, my name is Ava Wright. I'm a nursing student with Eastern Kentucky University's master's degree program with a focus on nursing administration. Today I'll be reviewing an integrative review paper and presenting it with a focus on coordination of care for patients diagnosed with hepatitis C. So the problem is coordination of care for those patients that are diagnosed with hepatitis C. In the United States, and specifically in Kentucky and surrounding states, there has been an increase in hepatitis C infections related to injectable drug use among people, especially under the age of 30. That came from a report from the Centers for Disease Control and Prevention. So when we're looking at evidence and the need for intervention, the Centers for Disease Control and Prevention have already published several reports regarding the increase in hepatitis C in the country, as well as the Healthy People 2020, and it focuses specifically on a couple of areas regarding hepatitis C. One is establishing early diagnosis through testing, and two is increasing the awareness of those who already have that infection and do not know it through testing. And so increasing those areas and establishing the need for collaboration of care to begin treatment and evaluation is important. The National Institute of Nursing Research has also focused on the need to improve quality of life for those that are affected with acute and chronic illness. And then finally, quantitative random controlled trials and data and research are also ways of collecting evidence that shows the need for that intervention. So looking specifically at some research and studies, there are a couple of studies that I reviewed through the process of this intervention, of this review. And the first study was a quantitative random controlled trial, and the basis of this trial was the evaluation of care coordination intervention for patients with hepatitis C. This particular study had participants that were in a control group or an intervention group. The intervention group received motivational counseling and education, which was enhancing their plan of care. And the intervention group was most likely to follow up with their providers with their hepatitis C virus follow-up visits, as well as receiving vaccines for hepatitis A and B. The study, unfortunately, is limited by the environment of the study, which was the methadone treatment program. And so all the participants were members of this program, and so it was difficult to apply it to the general population. However, it did show that there was an increase of willingness to receive care and treatments, more so than those that did not receive the enhanced counseling. In study number 2, which was also a quantitative review, the improvement of treatment outcomes for patients diagnosed with hepatitis C was focused on those who had psychiatric disorders. And there was this study implemented an integrated care protocol that included a multidisciplinary care coordination team. And through this study, it was found that a greater volume of patients received and began their antiviral therapy in the IC or integrated care group than those that were not. And the IC group had fewer hospitalizations, emergency room visits, and fewer deaths. This study also had some limitations through the use of the Veterans Administration or VA population, and the study was restricted to males only and those who also had a diagnosis of a psychiatric disorder. Also, through determining intervention, the foundation of this particular presentation was based on Ed Wagner's chronic care model. This model was developed in 1998 by Ed Wagner, and the focus is on 6 fundamental areas: community health system, self-management support, delivery system design, decision support, clinical information, and clinical information systems. Later on in 2003, they added 5 additional themes, which included patient safety, cultural competency, care coordination, community policies, and case management, which also, supports the intervention of coordination of care for these patients that have chronic disease. So how can all this improve nursing practice? The findings from the reviewed research may be applied to improve this practice through just the understanding and utilization of the collected research data as you have reviewed it, which leads to evidence-based practice. You're practicing based on evidence from these studies. This also strengthens our understanding about patients and what works with patients, what does not work with patients, and allows opportunities to provide a higher or highest level of nursing care. When looking at interventions, the intervention itself is collaboration of care for patients diagnosed with hepatitis C. So how will this be implemented? Through local clinics and health departments, I feel is the greatest way that they may use the research and data to implement a plan of collaboration of care through establishment of local policies and protocols. The public health environment is the optimal place to begin collaboration of care due to the availability of the clinics to all members of the community. Anybody can come to the health department. It is supported by local tax dollars and state monies, some federal monies. The local health department has a primary role of prevention of communicable disease. And so because that is a priority for the local health department, the opportunity to educate and collaborate care is even more important. Funding may be a barrier, and it has been in the past, and it is the role of the advanced practice nurse to intervene and assist with making decisions regarding the use of local funds as a possible option in the effort to provide the collaboration of care that is needed. As a local health department nurse, I feel that this is an excellent opportunity for the community to be supported through this intervention of collaboration of care, and I'm in hopes that change will happen. Thank you.